Left-Wing Kingz. Listen, think, act, repeat.
Reproductive freedom, rising medical costs, and prescription drug prices have been major concerns for years, and it seems that every candidate has a plan to fix them. Steve, how will the candidates seek to repair our healthcare problems, and which candidate has the better plan?
Okay. Both of them are talking, the big game, okay? Both of them are promising to keep the $35 cap on insulin. Harris is also talking about making it so you have a $2,000 cap for spending on medication, which is good. My problem with Trump is this. He's saying that he's not going to mess with the Affordable Care Act, but he tried to gut it 3 times.
Yep.
While he was president the last time. He tried to gut it with no plan. He's been president already. So when somebody has already been president, they've been in the White House for 4 years, and when they ask what's the plan, and he says, I have an idea of a plan, but he doesn't get, the concept of a plan, an idea of a plan, and he has nothing. What can you say to that? Now, one thing that I did like that he did was he allowed for medication to be shipped from overseas. My problem with that is this. A lot of people don't know this. America spends considerably more money for medication than other countries do because we are kind of the guinea pig place. Pharmaceutical companies charge considerably more here so that they can make it cheaper in other places. That, we need to address that. Neither one of them are addressing that, though. That's something that needs to be addressed. We need to make it so, I get that you have countries that don't have. Countries that don't have, I can kind of sort of understand. But countries like Sweden, countries like France, countries like England, they can pay for their medicine, just like we can pay for our medicine. Japan, they can pay for their medicine. We shouldn't have to subsidize everybody. That to me doesn't make a lot of sense. So, and it's not good enough to have medicine shipped from overseas because then you don't know what's in the medication a lot of times. I mean, you see people will go across the border to get medicine. They bring it back here and get sick, So that, what Trump was doing, although it is, in a way, it's a good idea, it's not reliable because you can't always rely on something that's getting shipped to you from overseas.
Yeah.
So I think Harris's plan is better, but to answer your question.
Yeah, I mean, healthcare. I go back on to the Affordable Care Act. He just, and the Republicans just are going to always try to do something with that. Like they say, like he says, he's got concepts. He ain't got really no plan, but he knows he's got a concept coming. And that's the problem. They're always going after that and don't have any plan or anything or whatever. So I don't trust them in that regard. The Democrats and Harris, I mean, they have, like I said, once again, they're talking about expanding that and making things better. I couldn't think of the specifics right now because I lost track of mine, but I just don't trust them when it comes to healthcare. I just don't believe in any policies. I mean, I haven't heard any policies or anything that he's trying to do with it when it comes to that, other than getting rid of the Affordable Care Act.
Yeah. And then also when you talk about birth control and stuff like that, there's a big fight on that. You can't have a fight on birth control and then say you don't want people to get abortions neither. You can't do that. That's unrealistic.
Well, I mean, our Robert Kennedy Jr. is going to be running women's health if Trump gets elected.
Yeah,
what I'm saying?
But that nigga had brain worms, man.
I think that if you look at that, aspect of healthcare for him, it's like you turning that over to Robert Kennedy Jr. You know what I'm saying? That's how much you think about it. Women's health. You know what I'm saying?
And
It's funny because like he said, I'm gonna let him run wild on this, and I'm gonna let him run. Even saying that, just the
Yeah.
perception that he gonna do some crazy shit.
Yeah.
yeah, 'cause he's a big anti-vaxxer, and we've already had a pandemic. Okay, you start looking at freaking measles outbreaks, mumps outbreaks. You know, people not getting their flu vaccines, and you have all sorts of flu outbreaks and stuff like that. That can be financially detrimental. You can have a lot of deaths. And again, all of this is because this is just my opinion. I don't think that they are very forward thinking, at least, as far as Trump's handlers or whatever, because I don't think he comes up with this shit on his own. Yeah, but they're not very forward thinking when it comes to healthcare. I mean, Robert Kennedy is not he's not somebody who is equipped to handle something like that.
He's an environmental lawyer, ain't he?
Yeah.
But
So I'm saying.
yeah, but that's crazy because even with that, how are you going to support Trump and you're an environmentalist?
Yeah, I don't know.
That's
I
like
don't
that's like a vegan saying I want to go to the butcher shop, man. That's crazy, man. No.
Yeah, and he don't know no doctors. You know what I'm saying? Like Robert Kennedy Jr., like out of all the people, he don't know no doctors that he could put in, he could have said that for. It's just, and I think a lot of what he's saying right now close to the election is just shock value stuff. Like, I'm put him in women's health. Like, I'm like, what?
Yeah.
But he does backward stuff like that. He could have had Ben Carson in charge of that shit last time. He put Ben Carson in charge of HUD. Why you got the medical doctor in charge of HUD?
Yeah.
He does stuff like that. He puts people in places that they don't belong.
Yeah, that's crazy. So.
Yeah. Well, I mean, dude also says stuff that, coming out the side of his mouth, craziness about all types of things when it comes to healthcare, like he did with like COVID and all the other shit. So, I mean, it's not hard to see that he might, go left when it comes to healthcare. And he might also go left when it comes to taking care of our earth with climate change.